welcome everybody to the last webinar in the series of 5 webinars organized jointly between UN Women and Prevention Collaborative in the area of prevention of violence against women. And today our topic is on social protections and violence prevention. And we have the expert Amber Peterman, who would guide us through the conversations. So allow me to introduce Amber before she starts her presentation. Amber is a research associate professor in public policy at the University of North Carolina at Chapel Hill, where she co-leads the Cash Transfer and Intermediate Partner Research Collaborative and is a transfer project affiliate. She previously worked at UNICEF's Office of Research Policies, Social Policy Specialist, and collaborate with a variety of policy and research organizations, including with the Prevention Collaborative, which she's representing here. And today's topic, it's to many of us, it's quite new in the field of violence against women, but also it's not so new when there have been a lot of work around linking economic empowerment and violence prevention and response. But social protection look at the bigger lens than just economic empowerment. And hopefully Amber can help guiding us more through these conversations. We have around an hour for the presentation, Amber, so you have this time to present, and then we would have the 30 minutes at the end for Q&A. At the meantime, we will be monitoring Q&A and select some of the questions for your answers at the end. So over to you, and thank you for joining us today.
Thank you so much for the invitation to share with you today, and good morning, good afternoon, colleagues, wherever you are. So I'm going to get right into this. I'm quite excited about sharing some of the work we've been doing from the research side, but also kind of extending that into some promising practice. I've been working sort of in this intersection for more than 10 years, and it's really great to see the increased interest over time. So just to give you a brief overview of what I'll be talking about, first, because I know a lot of you are coming from the violence world, I wanted to give a brief framing and introduction to social protection and social protection systems and the variety of different instruments we kind of consider under this umbrella. And then I want to do a very high-level overview of what we know from the evidence, and also importantly, I think what we think the evidence gaps are and what those key evidence gaps are that we're trying to fill. Then I'll give a few brief case studies so that we can really focus in on a few different examples of models that have tried to tackle violence prevention directly, as well as models that haven't, but have had these beneficial effects on prevention. And then I'll talk finally a little bit about design and delivery of social protection. So what are the actual concrete opportunities and recommendations that we see here when we're thinking about adding some gender sensitive or violence sensitive components onto social protection. So those are the 4 main kind of buckets that we'll go through today. So let's start off. And first, I just kind of wanted to give a broad overview of how I see the two fields intersecting. And so, of course, many of you will be familiar with these various categories of VOW that we're concerned about, including intimate partner violence and the very high levels that we see across the globe. And of course, not only violence inside the home, but also violence outside the home and the intersection with violence against children, including against adolescent girls. On the other hand, we have social protection, and we usually think about 4 different types of social protection according to sort of accepted broad definitions. So we have social assistance, social services, social insurance, and labor market policies, and I'll go into this a little bit more. But globally around the world, nearly half of the population is covered by at least one social protection benefit. And so, of course, from the social protection side, we say this is not nearly enough, and we're pushing for universal social protection floors as part of SDG 1. But the issue remains that kind of this is a broad platform that is reaching many, many different people, and especially a lot of the most vulnerable people. And on the other side, we have VOW, which also reaches or unfortunately touches many people's lives. And so there's this big opportunity for intersection. And I think when, you know, I talk to different groups of people, different stakeholders working in different areas, I see sort of 4 different reasons why people sort of come to this intersection or are interested in this intersection. And the first is just that the well accepted, I think, acknowledgement that poverty is a risk factor for VOW. And so social protection, obviously, that's kind of the bread and butter, is trying to affect poverty, reduce poverty. And so obviously there's this good sort of intersection where we think of social protection as potentially preventing forms of VOW. The second sort of reason I see people interested in this intersection is because social protection just offers this platform for reaching vulnerable populations. So the poorest, the most marginalized are often part of social protection targeting, and this offers an opportunity to layer on or address sort of violence components within social protection. So the third reason I see people interested in this intersection is because of synergies. So thinking from the social protection angle, addressing VOW in programming can directly help affect the types of main outcomes that social protection is interested in. So addressing violence actually helps meet their main objectives, which are usually tied to poverty, food security, human capital accumulation. And then the last reason is sort of the importance within programming of doing no harm. And so obviously social protection actors are interested in safeguarding and understanding, you know, mitigating against potential harm that their program might be causing at the grassroots level. So those are sort of the main different entry points that I see people coming at when they're interested in this intersection between VOW and social protection. So kind of zooming back out to social protection, I think one of the main kind of catalysts recently in thinking about gender transformative social protection, it was the COVID-19 pandemic. And so the COVID-19 pandemic was seen as sort of a game changer for social protection, as it was sort of this unprecedented investment in new models of social protection. We had about a $2.9 trillion investment in different types of social protection, which was about 3% of GDP over the first year of the pandemic. And so this was really sort of a big moment for social protection to serve as a countervailing force to sort of the economic and other social insecurities that were brought about by the pandemic. Now, despite this, as UN Women and other colleagues have shown, the government social protection response tended to not account for gender. So when you look at across all of the different new social protection and labor market responses, just over 3,000 of them, only about 19% of them either targeted women's economic security or supported unpaid care. So that we say kind of only about 1 in 5 directly addressed sort of these gender issues or accounted for gender in their basic design. And of course, this percentage is even lower in some of the global South regions, including Sub-Saharan Africa and South Asia. So I just wanted to kind of take a pause and get an idea based on sort of that framing where everyone is coming from. And so if I could have the first poll up, I was interested in knowing if you all are coming from this sort of approach to the intersection as a VOW or protection researcher, practitioner, or from the social protection or poverty focused background, or a little of both, or sort of another complementary lens to this issue. And secondly, I wanted to know sort of what your main entry point or interest in this intersection was, thinking of those kind of 4 intersections that I described earlier on the slide. So are you thinking of social protection as a platform to reach key populations, or are you thinking of social protection from the safeguarding point of view, et cetera? So if you could go ahead and fill the poll. I actually can't see at this point the responses, but hopefully they'll be coming up soon. Give people a few minutes. So I'm wondering actually if there's a way I can see the poll, or if someone else can. There we go. Okay, great. Okay, so we have mostly vow or protection focused folks on the call today, a little over 20% social protection, and great to see just under or just about a fourth of you are coming at the angle or the intersection of the two issues. So that's great. And the main entry points that you're choosing are vow as a prevention pathway. So the fact that social protection addresses poverty, and poverty then can reduce violence, but also social protection as a platform to reach key populations. Okay, so that gives us a little bit of an idea of who's in the room. So great to see that variety. So let's now move on. Okay, so I wanted to talk a little bit now about sort of the core facets of social protection, give you a little bit of a primer. So there are many different definitions of social protection, but I like this one from the UNICEF Social Protection Framework, which is a set of policies and programs aimed at preventing or protecting people against poverty, vulnerability, social exclusion throughout their life course, very important, and then with a particular focuses or emphasis on vulnerable groups. And so as we saw before, social protection can mean many different things, but I think some of the core features that I think are important and that others have sort of galvanized around are that it protects against multidimensional risks over the life course. And so we're not talking about a one-off thing, we're talking about a system that can be in place over your entire life during times of need. It's linked to human rights and a state citizen contract for protection. So this is seen as sort of a rights-based approach to social protection. And then it comes in many different forms with many different objectives, including both short-term and longer-term assistance. And ideally, it's a system of integrated support with coherence rather than sort of these one-off individual programs. So those are some of the main sort of facets of social protection. And as I mentioned before, there's usually sort of in this taxonomy of social protection, there's usually 4 different buckets. And often these buckets are distinguished using non-contributory or contributory models, which of course means that in the non-contributory models, you're not paying or feeding into a system to get benefits back. It's simply a right and a benefit delivered to you, while in the contributory forms, you are paying in, it's a paid-in model where you are paying over time or during certain incidences, and then the benefit, and then you accrue the benefit. So under social assistance, this is sort of the category that we talk about most in the literature, and this includes social transfers, so cash, vouchers, and in-kind transfers, public works programs where it's sort of cash for work, usually short-term work, and you receive a payout for the amount of work you do, fee waivers for basic health and education, subsidies, such as fuel or food subsidies. And then we have a second category, which is social care, which are family support services or home-based care or childcare services. And then on the contributory side, we have social insurance, all different types of insurance, and a variety of different labor market policies and interventions. And so these definitions, different organizations have slightly different definitions of these different buckets, but they're sort of coalesce around these different forms that are sort of important in both the public and the private sector. And so just thinking about how we apply these to the gender and violence field, I just wanted to give a few different examples of these different types before we move on in the discussion. So an example of an economic transfer program was one in Ecuador run by the World Food Program to Colombian refugees and poor Ecuadorians, where cash, food, and vouchers were given primarily with the objective of food security. This same program had a beneficial effect not only on food security and social cohesion between the hosts and the refugees, but it also reduced intimate partner violence. Another example of a public works or cash for works program was in Laos, where there was a women's only road maintenance group, which provided part-time work to women. And I'll talk a little bit about this program later with respect to the gender and violence impacts. An example of a fee waiver was in Ghana's flagship LEAP 1000 program, which gave cash transfers and a premium waiver for health insurance enrollment in the National Health Insurance Scheme to women with young children, which had a beneficial impact on intimate partner violence. In terms of subsidies, there's an example from the COVID-19 pandemic in Canada where rental subsidies for violence survivors were given, specifically targeting survivors. In terms of social care, we talk a lot about childcare programs or other types of protection care programming. And one example of this is in Mozambique in the Child Grant Program, where caregivers, female caregivers of children under the age of 2 were not only given an unconditional cash transfer, but they were also linked up to case management and care services as part of the program. I'll talk a little bit more about this one as well later on. In terms of social insurance in the US, we have unemployment insurance to violence survivors, sort of similar to Canada's program. In Bolivia, a job training and search assistant program for youth reduced various forms of GBV that adolescent girls faced. And finally, in the Philippines, there is a national domestic violence leave policy attached at the national level, but attached to formal work. So those are just some kind of concrete examples of how these different types of social protection could play out to address a gender or violence lens. So when we talk about sort of the different types of social protection, we can also think about different levels that are important for social protection. So this is sort of a complex graphic, perhaps, that I'm going to show a short video clip about. But basically, you have 3 different levels. You have the policy level in the middle, which includes legal frameworks, financing, and governance for social protection. You have the program design level, which includes many different components that can all be sort of tweaked to include a gender lens or violence lens. And then you have the program implementation or delivery sort of on the very outside. And this, of course, is also very important from a violence perspective and can greatly affect sort of the impacts that your program has. So I'm just going to play this part of this short clip that was developed by the Social Protection Technical Assistance group that I was part of during COVID-19, our role was trying to integrate gender into all of the immediate social protection responses, but I think it gives a good overview of some of the issues that the social protection field is thinking about, especially in the sort of new era of multi-shocks, not only social protection in COVID-19, but also in response to climate and other risk disasters.
The COVID-19 pandemic has been a crisis like no other in recent times. Worldwide, the socio-economic impacts have been rapid and hit people hard, affecting us all, but not equally. Social protection has been central to the government response in many countries. It has been helping people to manage the economic fallout of the pandemic in their own lives through a combination of social assistance, social insurance, and labor market interventions. Governments have worked to prevent routine social protection programs from collapsing under the strain of increased demand just when people needed support the most. But this was not enough. In many countries, governments also adapted programs and created new ones to increase coverage, reaching more people, particularly those hardest hit. To increase adequacy, providing more support as people's needs grew, and to increase comprehensiveness, addressing new risks such as temporary unemployment, loss of informal income, and increasing levels of gender-based violence. In all this, priorities have been to act fast and to try to include everyone who needed support. Has each country's response been the same? Absolutely not. Responses have been influenced by the funding available, political will, and the strength of existing social protection programs. But strength is not only about programs, it's also about systems. Imagine social protection as a solar system. At the center is the policy architecture, the legal foundation, strategic vision, and fiscal framework that mandate and govern social protection programs. Next is program design, which uses evidence to work out who is entitled to support, the types of benefits and services they can access, and the level, frequency, and duration of support. The outer ring is implementation. All the functions along the delivery chain, from outreach and registration through to monitoring and evaluation. In settings where this system was stronger, parts of it were used and adapted to respond to the COVID-19 crisis. For example, many countries built on existing data and information systems to help reach people in need. Where the system was less strong, in countries just starting to build social protection systems, or where there were gaps in provision, humanitarian actors played an important role connecting functions from their own systems to strengthen and complement weaker elements of social protection. COVID-19 may have been exceptional, but these lessons apply well beyond. All countries experience multiple and overlapping shocks. Some of these are recurrent and predictable. Governments, those of us that advise them, and others funding or working to deliver emergency response can take steps now to prepare for future crises. How can we do this? First, we must strengthen routine systems, reinforcing each and every element so that social protection systems are ready to protect anyone in need throughout their lives. This crisis has reminded us that we are all vulnerable. Second, we must understand what different people need and remove barriers that prevent some people from getting assistance. When the routine system is better at including people, emergency responses that build on that system will be too. Third, we must use a shock lens, making sure a country's social protection system is built upon an understanding of the risks its people face. This may entail many small and simple changes. And fourth, we must coordinate across sectors, ensuring we focus on joint outcomes, work together, and learn from each other to improve preparedness and emergency response. COVID-19 has reinforced what needs to be our collective mantra. Preparedness is essential. We need to act now to prevent future shocks from becoming crises.
Okay. So that was a quick view of what the issues that social protection is dealing with and some of the key sort of entry points for thinking about a gender lens and a vow lens. So I wanted to now move on with sort of the next step, which is to talk about the evidence on social protection and vow. And I just wanted to give you some key high-level consensus statements about what we know. So one, we know social transfers, including cash, food, and vouchers, reduce intimate partner violence. We also know that Cash and Cash Plus programs are promising for prevention of other types of vow inside the home, including sexual exploitation and abuse of adolescent girls. Third, we know that reductions tend to occur through three main pathways. The first is an increase in economic security. The second is a reduction in intra-household conflict. And the third is an increase in women's empowerment. And fourth, we know that design and delivery features can facilitate prevention potential across different social protection instruments. And so I'm going to be talking a little bit more in the evidence section about cash and social transfers because that's where the evidence lies. However, there are evidence gaps and things that we need to fill together. And some of this is sort of what we know less about, and what we know less about is other types of social protection, including public works, social care services, and social insurance, or programming attached to formal employment and how those might affect vow. We also know less about impacts on vow experience outside the home, which I think is really important to think about, including sexual harassment at work, trafficking, technology, facilitated vow. And then finally, I think we do need more testing of violence-specific programming. So in the past, a lot of the programming hasn't really intentionally thought about violence against women in terms of the programming and in terms of the evaluations of those programming. And so we need more of those sorts of models being tested and integrated into social protection more broadly. So those are sort of the main sort of takeaways from the global evidence, and I want to go a little bit deeper in terms of some of these consensus statements. So first, I wanted to talk globally about what we know. And so I want to talk about two different sort of review papers. The first was published in 2018, and this included a review of 22 different rigorous studies. 14 of them were quantitative and 8 of them were qualitative. And what you can see here from this sort of high-level summary, the blue is quantitative and the purple is qualitative. And you can see that out of these 22 studies, 16 of them, so about 73%, showed at least one meaningful decrease in intimate partner violence. And so a higher proportion of the physical and sexual IPV outcomes showed decreases as opposed to the emotional intimate partner violence outcomes. And the remaining studies were either mixed. So there were 2 studies that were mixed, meaning that they showed both increases and decreases across different measures. And then 4 of the studies showed no relationship. So at the time that this is now a few years old, but I think one of the key takeaways from this review was just to show that among these various different studies on cash transfers, of which very few, if any, were intentionally designed to reduce IPV, we're seeing nonetheless these large sort of decreases that in fact ranged from 11% to 66% decreases over the project periods. And so this was quite, I think, encouraging at the time. The second review came just a few years later. This was a similar review in terms of focusing on cash transfers and IPV, but instead of sort of discussing sort of the results in a more framework and thinking about mechanisms as the previous review did, this one was a meta-analysis, and so it included only quantitative studies, and there were 14 included. And this review also found average decreases in all types of violence, so both physical, sexual, emotional, and controlling behaviors, and these ranged from 2 to 4 percentage points on average. So also quite promising. And, you know, when I talk about this literature, I think, you know, it's becoming more well-known in the violence field, but now at this stage where we're at is that we have probably what I would say, I guess, the most robust and sort of widespread evidence base showing that cash transfers can reduce IPV. I think it's larger than any other single evidence base in the violence against women field at this point. So one of the things that the first review did was to look at sort of the pathways of impact from the cash transfer to intimate partner violence. And so I wanted to talk through some of these pathways because I think they're really important in sort of understanding application to program design. So the first pathway is sort of the obvious one, I guess, which is through economic security and emotional well-being. So cash increases sort of savings, assets, food security, etc. This can lead to improved emotional well-being in the household, including improved mental health, decreased poverty-related stress. This can also decrease alcohol use in some cases, and these factors can lead to a reduction in intimate partner violence. And this is a quote below from the previous program that I mentioned, the World Food Program, Cash, Food, and Vouchers in Northern Ecuador. A respondent saying, in my household, it was like happiness. We all got along because before we didn't have enough money for food. And so this is quite a strong pathway that we routinely see in the different evaluations that we've studied. The second pathway is through intra-household conflict. And so on one hand, increased availability of cash or economic resources at the household level can lead to decreased conflict in the relationship. On the other hand, increased availability of cash can also lead to increased conflict if there's disagreements about what the cash should be used for. So this pathway sort of is two-dimensional. It has potential to go either way, but what we see in the literature is overwhelmingly the top sort of pathway where increased availability of cash really tends to decrease conflicts. And so there is some literature that on cash and temptation goods like alcohol purchases, tobacco use, etc. And by and large, we find this isn't really evidenced in the literature. So this is sort of a myth that, you know, cash transfers will lead to sort of these adverse use of temptation goods. And this is here a quote from a cash transfer beneficiary in Turkey, just saying, you know, there have been many fights. It's because I used to ask my husband for money and he'd say there's no money. I'd get upset, and we had many fights because of poverty. So it's not only for us, for all the poor, fights come from suffering. So we also see quite strong evidence of this pathway in the literature. And then the third pathway is one through women's economic empowerment. So this is the idea that either cash or additional services to women can increase their financial autonomy. It can increase their productive investments or their self-confidence. And this also can lead to sort of a bidirectional pathway. On one hand, if a partner is accepting of that new power that the woman has, that can lead to reductions in IPV. However, if a partner feels threatened or concerned that a woman is taking over their power in the household, they can actually use IPV to sort of try to reclaim that power. And here is a quote from a beneficiary in Northern Uganda who is talking about using the cash to kind of start a small business and have some sort of earnings for herself, and saying that she now has a say in how to spend her own money and her own income. So when you put all these three pathways together, you get something like this, and this is a framework from the the review paper that I previously mentioned, showing how the different program design characteristics can lead to the various pathways and both increase or decrease intimate partner violence. However, as I showed, we overwhelmingly see evidence of decreases, so this preventive effect. So just to say a few more things why I think the pathways are important. I think that, we often don't collect data on these in evaluations, but I think they're very important because they speak to some of the common behavioral mechanisms that might give hints about how the evidence will translate into other programs and other settings. They can also serve as a basis for thinking about some of these design and delivery tweaks within social protection, and also help us think of synergies and impacts in implementation, because there is quite a strong movement to thinking about cash plus programming and adding additional programs onto social protection, primary social protection instruments. But I think we really need to interrogate, where is it that we see these synergies in impact and implementation, and how does this play out over kind of the conceptual framework or mechanisms through which social protection can reduce VOW. And so when we don't see those impacts, synergies in impact or synergies in implementation, it might not make sense to try and do a cash plus program. It might just make sense to do, the cash program separate from the violence program, for example. And I think our understanding of these mechanisms and pathways is also continually advancing as we get more studies and we think about more diverse environments. And so in addition to those three main pathways, we now think there is also potential for a few more pathways, and I just wanted to mention those quickly. And those are intergenerational effects. So the fact that if you do have a less violent home environment, this may normalize more healthy relationships and an environment for children as they transition to into adulthood. And I know one of the previous seminars was on synergies and intersections between VOW and VAC. And so I think this is also a very important factor when thinking about social protection across the life course. And then also many different social protection instruments and programs now have these sort of linkages to services as well as activities at the community level, and women's participation in programs might actually help increase interaction with program staff or services, which may directly lead to help seeking or lead to a deterrent effect if men know that women are in groups, if they're talking, potentially exposed to different services and people who might notice or know about their actions inside the home. So I wanted to just do another poll before going into the next set of sort of case studies that dive a bit deeper into those different types of models and these different types of mechanisms. So if we could get the next poll up here, these are some true false questions based on the literature. I don't see the poll, but maybe. There we go. Okay. So the first is that social protection should be targeted to women in order to have impacts on VOW. The second is different design components are needed for social protection to reduce VAC in addition to VOW. And the third question is when social protection support ends, which is often the case in these short-term instruments, including the ones implemented during COVID. So when these short-term support ends, the levels of VOW revert to the pre-program levels. So these are all true, false questions for you. maybe we can take a look at the answers. So the first, we have about 2/3 saying social protection should be targeted to women. And then the rest went away. I can't see them. I don't know if we can get those back up momentarily. Otherwise, we can just go on. There we go. So different design components are needed for social protection to reduce VAC in addition to VOW. We have almost everyone saying, yes, we need different design components. And then when social protection ends, levels of violence revert to pre-program levels. And we have about 60% saying yes on this one. So those are a bit, let's say we don't have the final answers on all of those, but I'm going to just talk through a few case studies where these were the case to get you thinking a little bit more about them. So the first is that cash transfers need to be targeted to women to be effective. And actually, we don't see that this is the case. So here's an example from Mali, a government program, which gave quarterly transfers of about $18 a month to heads of household who were men, and primarily men, let's say. And this was over 2 years, and there was a nice impact evaluation carried out by colleagues at the International Food Policy Research Institute. And so you can see here are the prevalence of intimate partner violence. After 2 years, we have physical, emotional, and controlling behaviors. We have the treatment group in orange. And what you can see by and large is that for women in non-polygamous relationships, there were slight reductions, but only for emotional violence. But in polygamous households, we see large reductions in violence across the board. So ranging from about 23% for controlling behaviors to 38% for physical IPV. And so I think we thought that this case study was quite interesting. It has also been supported by other cash transfer programs, that the mechanisms in this case were through increased household economic security and through men's emotional well-being. And so we had these poverty-related stress going down, we had IPV going down, yet at the same time, there was no impacts on sort of gender relations. There was no impacts on women's empowerment. And of course, we'd love to see those. But we also see sort of these beneficial effects even when social protection is not targeted to women directly. The next is sort of question was around the VAC and VOW intersection. And so we have actually only just a few studies with measuring both either violence against women and some sort of violence against children. We have these 5 different cases from different parts of the world. They're diverse models, different types of social protection, different time periods, different target groups. But I think one of the very promising results of these 5 different evaluations is that you see similar patterns of effects. So in all the cases where there were reductions found for intimate partner violence, they were also found for violence against children, with one exception, and that's in Colombia, where they found reductions in IPV, but not on violence against children. So I think while these are very sort of initial look at the evidence, we do see that these studies reinforce the shared risk factors between VOW and VAC, and especially on the economic side, and the benefits of designing to and preventing both types of violence in one program. And the last question was about what happens when transfers end. And here as well, we have few studies, but one that I think is notable is the World Food Programme's Transfer Modality Research Initiative in Bangladesh. And this was cash or food transfers of about $18 per month given to women, in addition to intensive nutrition behavior change communication, or BCC. And so they had this nice randomized control trial also carried out by IFPRI. And what they did was they did a post-intervention survey 6 months after the program ended, and again about 4 years later. And I will actually say that they went back again just recently. So we now have an 8 years later round of data, which is sort of, stay tuned for that because it's being analyzed now. But I think the exciting thing that they found is that at 6 months post-program, they found reductions in the arm where there was the additional nutrition BCC intervention. And so this is the red sort of bar here. You see the levels of physical IPV are quite a bit lower than the control arm and the cash-only arm. And when they went back 4 years later, they found that these differences has actually increased. And so the trajectory sort of between the cash and nutrition training arm and between the control sort of even continued to diverge once the intervention ended. And the most salient pathways that they found here were women's bargaining power, men's cost of perpetrating violence, and household poverty-related emotional well-being. And so the takeaway sort of from this evaluation is not that you need to attach nutrition BCC to every social protection programming, but that in the context of Bangladesh, where there are strong norms about female seclusion, not only getting women together in these groups increased their sort of social connections and social capital, which led to sort of increased autonomy, but then also this increase or reduced household poverty related stress and increased economic security of the household. So sort of the last topic I want to talk about now is how we can practically sort of design social protection programs to maximize prevention and minimize adverse effects. We have all these great case studies where research has been done that has shown reduction potential, but how can we practically think about this applied to any given program that might already be designed and we want to tweak it, or that we're designing from the start to be gender and violence sensitive. And here I want to go back to sort of 5 different design considerations that every social protection program needs to think about. So the first is targeting. Second is the amount, frequency, duration, and predictability of benefits. Third is the delivery and the operational considerations around benefits. And fourth are system linkages and complementary programming. And finally, we have safeguarding, and I'm not going to talk a lot about this because we wanted this webinar to focus on prevention, but of course, I want to talk about a few of the resources that are available to you if you're interested in this area. So the last poll, maybe we can do this very quickly, is just to see which of these categories that you see as most critical for your work or that you're most interested in knowing more about. So those are just the same categories that were up on the PowerPoint slide. Maybe we can see the results for that. Okay, so we have the biggest interest in system linkages and complementary programming, which I think is not too surprising. I anticipated that would be the case. We have safeguarding and amount, frequency, and duration of benefits next, followed by targeting and delivery as the last interest. So I think all of these issues are important to consider because they give us different entry points into a system or a program which might be not considering gender in the first place. And so I think we need to leverage all of the different options that we have available to us. So these sort of recommendations come from a brief that I'll show quickly on the screen as well so that you get an idea of where you can go for more information. But what we try to do in this brief is take the different evidence that was available to us and think about the mechanisms of impact and how sort of the different mechanisms and different evidence could lend themselves to these recommendations. So our first sort of thinking is the targeting, and obviously this is one of the first things that programs have to deal with, and we have some recommendations at the household level and at the individual level. So at the household level, one recommendation is to ensure the inclusion of households that are economically insecure and vulnerable to conflict, and that might mean different things in different settings, but the idea here is the amount of the transfer and sort of the biggest bang for the buck is going to be among those households that are sort of the worst off to begin with. And this is something that, you know, social protection systems often think about, but are not always thinking about the vulnerability to conflict. They're more likely thinking about economic insecurity. The second sort of recommendation is to include households with children and adolescents in order to try and promote this virtuous cycle of intergenerational protection. So we now are seeing, as I showed, that there's sort of potential for creating this virtuous cycle. And if we include households with those demographic categories, we're more likely to sort of trigger that additional mechanism. And then the third recommendation at the household level is to consider universal or near universal targeting within geographies. And if that's not possible, to include transparent targeting. So some of the operational literature shows that kind of these very concrete or very transparent targeting formulas lead to less sort of more acceptance within the community and across households in terms of who is getting the benefits and why. Now at the individual level, we also have some recommendations on targeting. One is to prioritize women as the named recipients. So even though we see that social protection can reduce violence when it's targeted to men or targeted more generally at the household level, we do want to try and prioritize women when we can, because we know that there are existing power dynamics and we want to promote equality. This is not always initially accepted in different settings, and so alongside prioritizing women, we recommend building community support for participation of women directly in whichever means that may be, either enrolling key stakeholders, a messaging campaign, or a framing of the benefit as sort of for the family good. Secondly, if benefits are at the household level, we recommend considering classifying co-wives and polygamous unions as distinct recipients and distinct households. So we see often that polygamous households are more conflictual, have higher levels of violence pre-program. And there's also potential for conflict if there is not enough support across a very large household. So this is one sort of very context-specific, concrete recommendation. And then finally, consider relaxing or removing conditions or any other co-responsibilities to ensure eligibility. These are often made the responsibility of the woman, and we would like them to be more framed as a household responsibility if conditions need to apply. So the second sort of bucket is the frequency, duration, and predictability of transfers. And here we recommend providing benefits of a substantial value to ensure the meaningful effects on these mechanisms of change related to poverty. So this is the bread and butter of social protection. And definitely there's a push to kind of cover a larger swath of the population in a program, but we have to be really careful about that because benefits are sort of diluted in this way, and you won't have a good chance of making a meaningful impact on the mechanisms. Where possible, we also recommend providing regular, frequent, or automated benefits, which may be more likely to be controlled by women and be more likely to be accepted by power holders in the household. And third, providing clear communication about the frequency and duration to facilitate financial planning and reduce stress around uncertainties is really important as well. Next, I wanted to talk just briefly about the delivery considerations. And of course, these are, there's many more recommendations that could be added here, but I think these four are sort of key. So if women's access to mobile phones and digital literacy are high, it's good to consider mobile transfers, as these might increase sort of women's ability to maintain control over the transfer, and is less likely to be seen or appropriated by others. Second, consider delivering benefits or activities through existing women's groups to facilitate social capital and solidarity. Third, to integrate grievance and complaint mechanisms. Obviously, these are part of any good social protection setup, but then also explicitly addressing VOW in that mechanism and making sure they're properly advertised, accessible, anonymous, and supported. And then lastly, to just ensure that the activities that go along with any social protection scheme are gender informed in terms of the time of day, making sure they're convenient and safe for women. And I just wanted to give one example of a public works program in Laos that had a nice evaluation attached to it in terms of operational considerations. Public works programs are not necessarily thought to always be gender sensitive, because they're often offering work in sort of low paid, less preferred activities. And you know, the same here, but they took sort of a gender informed approach. And so they had these rural road maintenance groups, and they were female only. They were only part-time, so that women who had other obligations like caring for children could still take part. They also had these groups sort of protected against harassment from coworkers and other community makers from making them all female. And they had sort of this kind of beneficial social cohesion effect from the community, because the community saw that they were sort of improving the conditions related to transportation. And so in this particular case, you know, many people worry that public works programs will actually increase VOW. And in this case, there was no impact on IPV or VOW, which both inside the home and in the community, which I think is very promising, even though we would definitely want this to go further and have a preventive effect. These sorts of gender-informed operational considerations at least show that you can sort of increase women's economic empowerment and have no potential backlash on VOW in this case. And the last kind of substantial category I wanted to talk about is the system linkages and complementary programming. And here I think there's many, many different options, but I wanted to talk about a few of the different examples that we're seeing being implemented. So one are these system linkages to violence-specific services, and these could involve a whole host of different options, from response and referral services to more dedicated case management services. The second one is just other types of programming to strengthen household economic security and that pathway through economic security and reduced poverty-related stress. And what we see are gender-informed sort of livelihood support, or productive asset transfers, or financial inclusion and planning. And so there's this sort of examples of all of these types of add-ons being implemented currently by government programs. Third are programs to improve relationships and reduce inter-household conflict between couples or within households. And here, some examples of these are parenting programs or couples-related trainings, dialogues that bring them together on valued topics, or aim to change norms explicitly. And there's a variety of different social protection programs that are doing this now, experimenting also with not only sort of traditional couples dialogues that we see in the VOW field, but also using alternative modalities like edutainment or radio programming. And then lastly, are programs or add-ons to empower women. And we see a lot of movement towards group-based approaches and increasing women's social capital, like the Bangladesh study that I talked about, but also more sort of out of the box sort of interventions to improve women's aspirations and agency or support their economic standing, including through offering childcare, which we know has demonstrated effects on women's economic empowerment and labor force participation. So those are some of the different types of complementary programming that we're seeing across different settings. And I know that now I'm slightly at time, but maybe let me just mention this example because I think it's a really important one, which is Mozambique's Cash and Care program. So this was one I mentioned previously, but it was part of the government's flagship social protection scheme, Subsidio para Crianças. It started in 2019 in the North, and it gave primary caregivers of very young children, both cash transfers and community-based case management. So we see here on the top, unconditional cash transfers given up to the age of 23 months, accompanied by case management at the community level, whereby at the registration for the cash transfer, there is a rapid triage done, and approximately up to 20% of the total caseload of the cash transfer program were selected as being high risk. These families were had a follow-up home visit by a community-based social worker that was supported at the district level by professional social workers to develop a family assessment, a case plan, and followed up over the next 3 to 9 months, specifically to address multidimensional protection concerns. So we did an impact evaluation of this startup phase, and I'm just going to sort of gloss over the results, but basically what you can see from this graph here is that the blue is the pooled treatment effect, reductions across the board, not only on IPV, but also on attitudes against IPV. And these impacts are coming from both sort of the cash component as well as the case management or care component. And we see very promising impacts not only on IPV, but also on violence against children. And so you see sort of the same sort of pattern here where we're seeing reductions, but in many cases, they're coming from not only the cash component, but also additional impacts from the case management, which is in the purple bars. And so one of the kind of interesting things about this study was, well, it was done during COVID. And what we saw was, despite a lot of sort of implementation challenges from the case management side, especially related to the high sort of level of human resources and trained social workforce that were needed, we saw these very promising impacts. And the government is now taking this model to scale. And so I think they will have both challenges in implementing at scale, but also I think it's quite promising that we're seeing this commitment and this kind of cash plus approach being taken forward. And just on safeguarding, before I wrap up, I'm not going to discuss this in detail, but there are quite a lot of toolkits and different resources for GBV and social protection, particularly from the emergency field, where we see different sorts of tools and guidance aimed at different sorts of needs, including a lot of very practical tools that let you do different sorts of assessments and monitoring to make sure that you're safeguarding in all the different ways possible that you can. And so some overall takeaways from program design is that, whatever you do in terms of tweaks, I think one of the things we recommend is to play towards social protection's strengths. So social protection is primarily a tool for economic support. So make sure that this core component is meaningfully designed and has a high enough value to make a difference in the first place before you try and layer on additional programming. The design features to empower women should be intentionally included alongside protective measures to mitigate against backlash. We would love to see some more complementary programming implemented in these different in these different schemes, and especially ones where we can credibly take it to scale and the scale that social protection reaches. But also we think we should be highly sort of critical about assessing where there are clear synergies and impact and implementation, and where it makes sense to definitely integrate the two different types of programming. And then, of course, design and implementation should be guided by a deep understanding of the gender dynamics in a particular setting. We don't think that a model that works in one place will necessarily work in another. And we've seen some of this play out in the evidence. And so we want to definitely make sure we're tailoring these approaches to context. And these sort of conclusions and these examples come from this brief that we recently put out through IFPRI, and which is available for more detailed information. So I think this is my last slide. I want to just revisit these consensus. Social protection can reduce different forms of violence, and through a variety of pathways. There's design and delivery features that can facilitate this, but what we know less about is different types of social protection, violence outside the home, and we need additional testing of these violence-specific programs. Hopefully you all can come in on this and help us move the field forward. I just wanted to also say that we do have this collaborative on Cash and IPV, where we are trying to both sort of produce more rigorous evidence, but also have some more action on the research to policy side. And our website is there. So thank you so much. And I apologize for going slightly over time.
No, not at all, Amber. Thank you so much. This is so insightful and interesting. I think we have learned so much today on this topic, and it's very detailed and elaborated. We have a number of questions, so I'm going to read them out for you so that you can help responding to them. Are there instances where social protection measures have had negative consequences for women and children? If you have any example for that. And one question is around, is there a reduction of vow because of cash transfer without exception? Can you share any case study of the exceptions? So let's go with those two first, and then I'll post other questions.
Yes, so the first question is social protection, if it can have negative effects on women and children, and I think the answer to this is definitely yes. I mean, we don't always see beneficial effects when we go down to the individual level. I think, you know, in the social protection field, we've only, I think in the last 5 to 10 years, really been talking about gender sensitive or transformative social protection. So typically when you go down to the country level, there's still many examples of gender blind programs in social protection. You know, these are always arguments we have to make to the finance manager, to the social protection, the ministry concerned with social protection. And so I guess one of the, I mean, I can give a few examples. Perhaps it's more likely that social protection just doesn't have, you know, an effect at reducing any sort of gender gap. But I guess, and some of these cases are settings where you would expect that a program wouldn't be designed with gender in mind in the first place. So for example, there is a recent evaluation of a cash transfer in Tunisia where women were receiving the benefit, and one of the main objectives of the program was to increase women's economic empowerment and labor force participation. They added on a financial training and budgeting exercise, and they randomized whether or not it was just women who got that financial planning and budgeting exercise, or if she did it together with her husband. And so one of the interesting outcomes of that evaluation was that women's labor force participation increased in the arm where it was just women receiving the training, and it actually had no impact in the arm where she did it together with her husband. And so I think we are trying to slowly move the social protection field to be more gender transformative, but at the same time, we're still looking for those models that actually work in different settings. And so we want to be thinking more about changing gender norms, which is very, very new in the social protection field. But we haven't figured out always the way to do that in the right way. And so I think the cases where social protection has negative effects on like the core intended outcomes is rare. It generally has positive outcomes in terms of food security, education, economic security of the household, but whether or not that positively affects the gender balance in the household is another question. So, yeah, that's maybe a long-winded answer to just say, yeah, it's not always a positive effect when you go down to the individual level. And then the second question, can we always say that social protection is going to have a reduction on VOW? And I think we can't say this. We have now, as I said, I think we have like over 20 very rigorous large-scale impact evaluations showing that especially cash and economic transfers reduce intimate partner violence, but this is not universal. And we can't, I think, necessarily assume that it will affect other types of VOW, and especially those sort of outside the household in cases where social protection is linked to some kind of other community activity. And certainly we can't say that it's going to reduce violence in the workplace or at work if the social protection instrument is related to an employment benefit. So those are things that we still don't know. And I think they're a bit more complex because there's many different settings, of course, where women experience violence, and we haven't understood sort of the broader effects on these other forms of violence.
Thank you, Amber. There are two comments and questions, a little bit long, so I'm going to read them out to you. One, the problem with World Bank data is that informal workers, where women are in the majority, especially in the Global South, are not included in the studies and are excluded from cash transfer or social protection programs. Also, what we see in some studies is that cash transfer alone doesn't shift behavior, but only integrated programming is critical to influencing GBV along with economic empowerment. Could you please elaborate on this point from the evidence you have seen? That's one. And another one for Julie, it's related to child marriage. Child marriage in Tanzania is high. It has a poverty element. Parents often marry off girls in order to obtain the bride price. The government has a National Social Protection Program, PSSN, that is giving conditional cash transfer to keep girls in school. It could potentially help to reduce child marriage. What is the evidence of social protection cash transfer program in reducing child marriage of girls?
Okay, so the first question around informal workers, I definitely agree. I think this was one of the large takeaways from the pandemic, and the social protection expansion really missed, what we call the missing middle, which are the informal workers, which aren't covered by the poverty targeted cash transfers because they're maybe not poor enough, but yet they're not covered by the formal social protection and labor market sort of employment schemes. And so this was, I would say, one of the biggest sort of lessons from the pandemic coverage, but yet I don't see a lot of action now in terms of reaching informal workers with social protection. So I don't know that I have a good answer to your question, but I would just agree that we need to do more in terms of social protection reaching informal workers, and we don't have a lot of evidence on them. I think one area which is quite promising, which I think we're trying to reach more informal workers on, is the sort of care and social services. And so I think we are, as a research community at least, now doing quite a lot of work in terms of informal childcare types of models, either to reach women in informal markets or via social entrepreneurs reaching in urban slum areas. And we are starting to do quite a bit of research on those sorts of models, which is quite promising. But at the same time, there is not really any evidence yet on violence against women in those schemes. And so I think this is really important. And I do also agree with your comment that integrated programming, holds a lot more promise. And I tried to show a few examples of that, but actually most of the research on these different integrated models and how much the plus component contributes and how much the social protection component contributes is still sort of emerging. And so we have a bunch of different studies on that are ongoing, but the truth is we don't know a lot about the different contributions between the two. So on the child marriage, social protection and child marriage topic, I think this is also an area, so I didn't touch on this in my presentation, but it is an area where there is now quite a bit of research. And I think on one hand, there is quite strong evidence that social protection schemes that focus on education, so either school vouchers or conditional cash transfers conditional on education, or economic benefits conditional on a girl staying unmarried to a certain age, which has become sort of popular in South Asia for some of the governments there, have been quite successful in reducing child marriage. On the other hand, I think that some of the more broad-based social protection, including like unconditional cash transfers, the evidence is not as strong. And I think some of the differences in the evidence actually have to do with how the research is done. So if there's a scheme that's focused on adolescent girls and is carefully tracking them over time and able to measure impacts on child marriage, I think that's quite different from a broad-based social protection maybe given to households or targeted at adults that isn't maybe able to track girls specifically, but then can look at some household demographics or something like that. And so we don't have as much evidence from those types of schemes. But there was, as many on this call might know, there was a recent sort of systematic review on what works to end child marriage or reduce child marriage and early marriage as well, which came out quite strongly on the potential of social protection over sort of some of these other multidimensional interventions. So for Tanzania, there are, as you might know, there are some different adolescent cash plus programming that are being considered and piloted and run by the government, layering on different livelihoods, interventions, linkages to sexual reproductive health services, and mentorship to adolescents. And that has shown quite promising impacts on a number of different outcomes, including young adolescent boys' perpetration of violence against women, but I'm not actually aware of the impacts or any impacts on child marriage. And so that's something I could definitely follow up on.
Thank you, Amber. Maybe a couple more questions before we close the webinar today. Do you have any example or good practice on social protection programs that allow women with disability to benefit from it, and also to prevent violence against women with disability, or to better respond to women who experience women with disability but experience violence?
Should I respond to that one?
Yeah.
Okay, so unfortunately, there is no research that I know of actually in the Global South on this topic on social protection, violence, and disability. Despite disability being one of the kind of key factors that determines a lot of the targeting, oftentimes in research and in many of the evaluations I've been involved in, unfortunately, when we do our sampling, we end up with a too small percentage of the sample with disabilities to be able to do any kind of intersectoral analysis. And so I think this is a gap in the literature. Nonetheless, there are many programs in the Global South that really are trying to advance this agenda and that are developing programs that specifically try to promote inclusion for people with disabilities. And so I'm sorry that I don't have any examples to offer, but I think this is one area that definitely needs to be expanded on.
Thank you. And maybe I have one comment, one questions for me, taking the opportunity to have the microphone. But how do you, what the experience of linking the two sectors to work together? Because oftentimes the social protection actors do not necessarily work on addressing violence against women or integrate this issue in their work. And also, on the other hand, how do we work with women rights organization or organization and actors that addressing or preventing violence to strengthen capacity and knowledge on social protection and economic security, and to work with the social protection actors in order to convince them to integrate prevention and respond in social protection policies and programs. Have you seen examples of these two fields coming together at the programming and also policy level?
Yeah, that's a great question, and I think it's something that we're trying to do more of, not just on the implementation side, but also on the research side. I mean, the social protection evaluations and research are traditionally done by development economists, and of course, violence experts usually are social epidemiologists. We tend to work in different silos, but there's so much value in coming together, and I think that's the same on the program side. We're seeing, I mean, many of the sort of leaders in the field of social protection also have, and I'm talking, about, I guess, the WFPs, the World Bank, the ILO, UNICEF. These are people who work, or actors that work a lot on social protection, and they often have, colleagues in the same organizations that are working on protection issues and on violence. And so it, I don't have any good strategies for coming together, but I think at the country level and at the national level, these sort of connections really just need to be made. I mean, for example, in this Mozambique case study that I showed, this was a collaboration between the UNICEF social policy team and the UNICEF child protection team. And I have to say that oftentimes, they weren't speaking the same language, and it took a lot of discussion to come to an agreement, but at the end, or throughout the process, I think everyone greatly appreciated each other's contribution, and they saw at the end of the process this like really strong effect of this collaboration, and not only at the country office level, but also their respective ministries and the government. So I think it's a matter of starting to have these conversations and seeing kind of how the result can be bigger than the individual effort of the individual organizations or individual divisions within an organization. And in terms of the women's rights actors, I mean, I think they can and should play a bigger role than they do now in social protection. I mean, there's always a role for advocacy, but I think, you know, starting from the beginning with consultations at the design process, listening to them in terms of their specific recommendations on how to implement these programs at the community level is really important. And you have some of these coalitions of women's rights organizations that, you know, that span across different countries and that touch different groups, including informal workers, that are starting really to be engaged in the social protection dialogue. And so I think that's very welcome. And there have been some efforts to try and pilot these sorts of individual consultations and programming at the country level that we can also look to. But thanks for bringing that up. I think it's really important.
Thank you, Amber. And this is precisely the effort that we're also trying to foster, is to bring the two sectors together to have a conversation. And as you rightly said, after the pandemic, we have learned a lot that we need to work better with social protection responses, because we have seen that violence will heighten during the pandemic, and because of responses can be an opportunity to address the risk factors and enhance protective factors. Thank you so much, Amber, for all this wonderful insight today. We hope to hear more about your work and about this great work that you have been doing. Perhaps maybe sometime we organize another webinar just to hear the updates of more evidence of this. Just from our side, I just would like to quickly share as well with participants that UN Women also just recently launched a policy brief on this issue. Let's see if I can bring it up. Screen.
Oh.
I don't know how.
I have to stop sharing, I think.
Okay, thank you.
There you go.
Okay, let me see if I can find this. Here you go. So, and actually Amber also reviewed this policy brief and provide her technical expertise comment in this. We just launched an evidence reviews as well on linkages between social protection and violence against women. And many of the results and key findings are very compatible with what Amber just presented. And this review hopes to introduce the conversation to practitioners and policymakers who are traditionally working around the area of prevention and responding to violence against women, so that we can build this language and we can have this knowledge to work with the social protection sector to integrate GBV work in social protection. So I would encourage all participants to visit this review and this policy brief. I also shared the link in the chat box, so you can have access to them. In any case, thank you so much again, Amber, for joining us today. We will share the recording with all the participants today. And hopefully we can learn from you next time, Amber. Have a good day. Thank you very much.
Thanks so much for having me.
Thank you. Bye-bye.